Before entering a scene, we want to make sure we have our PPE, gloves, glasses, boots, and we also have all of our gear. We want to first assess any dangers. At this scene, we've got a saw and a branch which has already been removed. They also give us an indication of mechanism of injury. We also want to keep an eye out for things such as bystanders or pets. Hello, we're here from the ambulance. What is your name?
Hi, Alice.
Hi Alice, my name's Shanti and this is Saskia. How are you going?
Hi.
I'll just take a look here. Got a little bit of blood. So far I can see the patient's airway is clear and they are breathing competently. How's it going today? In a bit of pain you look?
Yeah.
Yeah? What's happened?
I fell out of the tree.
Fell out of a tree?
Yeah.
Hey Saskia, could you please get a full set of vitals? Yeah, of course. What were you doing up the tree, Alice?
I was cutting the branch and I slipped.
Okay, you've cut your arm, so you're in a bit of pain. Could you tell me how much pain you're in out of 10? 10 being the highest.
I'm just going to grab your arm.
7. Okay, I'm just going to wet
Hold
this.
your wrist.
Put your arm out over like this. I'm going to flush out the wound. I'm going to apply a folded up damp dressing to the wound to try and maximise direct pressure, and then wrap that with a crepe bandage, applying pressure as I go. So you've got some pain out of 7 out of 10. Where is most of that pain coming from, Alice?
Or my ankle.
Yeah, and a little bit here from your arm.
A little bit from my arm.
At this stage, our patient has a GCS of 15, which gives me a rough indication of no major neurological deficit. But since we arrived on scene, our patient has had minimal head and neck movement, warranting concern for potential trauma to these areas. Okay, so do you know how you landed when you fell out of the tree?
Oh, I think I landed on my head.
Landed on your head, okay. Do you have a bit of a headache or anything? Do you have a sore head at the moment?
No.
No, okay. We'll take a look at that soon. I just need to get this sorted out first. Here we can ask about our patient's medical history. Do they have any existing conditions, or do they take any medications or anything else we should be aware of? Do they have any allergies, drug or otherwise? So now that I've got this bandage on, I'm going to reassess that distal pulse.
I have had a head injury before.
You have had a head injury before, okay, thank you for telling us that. You've still got a delayed cat reflex. I'll get you to elevate that up on your chest. Now Alice, I'm going to check over your body from head to toe just to ensure we don't have any other injuries that I haven't seen. Is that going to be okay? Just involves me touching you, seeing if you've got anything broken or any other injuries, any bleeding. Does any of this hurt?
No.
Okay, I'm just checking around the back of the head. So have you got any pain down here on your neck?
Yeah.
Just here in the centre? Okay. I want you to keep your head as still as possible for me, if that's okay.
Yeah.
Is it okay just how it is right now?
Yeah.
Without me touching? Great. Got any pain down here?
No.
No. Squeeze my hand?
Yeah.
Thank you. No pain down this arm?
No.
What was our blood pressure, Saskia?
Blood pressure normal.
Give me squeeze my hand down here. Thank you. Perfect. No pain down here.
No.
Give me a deep breath and out. No pain when you're breathing?
No.
I'm going to check your stomach.
Breast rate was 16.
So have you taken any medication since we've gotten here today? Before we got here?
No.
Not at all? No supplements or anything? You haven't taken anything else? Have you eaten this morning?
Yeah. I ate at about 10.
Okay. No pain down here. Wiggle your toes that I'm touching. Perfect. You are feeling a little cold. I'm just going to pull up your pant leg so I can expose your leg. I'm just going to compare it to the other leg. So you've got a bit of pain down here. I can see some angulation and some swelling. Can you just tell me when it starts to hurt?
Yeah.
Pupils are hurting down here?
Yeah.
Yeah. What kind of pain is it?
It aches.
Okay. Can you feel me touching the bottom of your foot?
Yeah.
Yeah. I'm just going to feel your pulse. Those are equal. Can you wiggle your toes up here?
Oh yeah, it's
Does that hurt? Yeah. Could you please mobilise Alice's head?
Yep.
And get out the collar, please. I've got a delayed cat refill, some redness, limited movement, and some swelling. That gives me an idea that there could be a fracture down on that leg. So I'm just going to sort out your head for now. Because of that pain that you had in the back of your neck, we're going to try and keep your head as still as possible. So we're going to put this collar on. Unfortunately, they are a little uncomfortable, but it is important that we get this on to protect you from any further injury. I'm just going to measure from here. And our collar is already set to your size. Locked in. Stay nice and still. Nice and slow. Saskia's going to hold your head. Very good. Just going to bring this up and around under the neck. Nice and slow. Try not to move from any. You're doing really well. How does that feel? Does it feel like it's got your head a little stabilised?
Yeah.
Yeah. You don't have any tightness around your neck?
No.
Perfect. Oh, sorry. Just going to put some blocks around either side of your head to try and keep it a little more immobilised. Free up Saskia's hands. Put those here. Thank you. So is your pain still a 7, Alice?
Yeah.
Yeah?
Yeah.
Okay. Sort out some pain relief in a second. Get this down here. Okay. I'm going to take a couple more vitals. Saskia, could you please set up a splint for the leg?
Yeah, of course.
Awesome. Just going to check your heart rate down here. So your heart rate is 110, which is slightly elevated for a normal 60 to 100 beats per minute. Next, I'm going to take a blood pressure, similar to what Saskia did earlier. Just lift up your arm. Thank you very much. And Saskia, once you've got that splint sorted out, can I please get you to reassess Alice's dressing on her arm, just to ensure there's no more bleeding, of course. Little tightness on your arm, Alice.
Yeah. I'm just gonna take some.
So your blood pressure is a little low. It's 100 to over 50. Normal is 120 over 80. Do you know if that's normal for you?
It's normally a bit low.
Okay.
Yeah, okay.
Now I'm just going to have a listen to your lungs. I noticed that your rest rate was a bit high from when you had your arm elevated up earlier. Normal is 12 to 20 and yours is about 25, so we might want to get some O2 set up. She's feeling a bit cold and clammy, a bit tachycardic.
Yep.
She might be experiencing shock. Can we just get some nasal prongs set up at a flow rate of 3 litres per minute?
Yeah, of course.
Just going to have a listen to your lungs, Alice. Can you just take a deep breath in with your mouth open? Other side. Very good. Down here. And again. Perfect. Just going to check up here as well. Great. Other side. Very good. Lung sounds are clear and even.
I hope you know you might be a bit uncomfortable, okay?
Okay.
Just going to set up some pain relief for you, Alice. I'm going to give you some methoxyflurane today. Have you had this before?
No.
No? So you haven't had it in the last week?
No.
No, okay. So this is a fast-acting pain relief that you have to inhale yourself. It is going to make you feel a little lightheaded and a little bit sick, but it will definitely take away your pain.
Yep.
When we're using this, we need to ensure that you don't have any renal impairment, do you?
No.
Have any non-kidney problems?
No.
No. And do you have a history of malignant hypothermia?
No.
No. And so you're obeying commands today, which is great, which means I can give it to you. So we want to ensure that we check our dosage, which is 3 mils for an adult. Got the right drug, patient, dose, time and route. I'm just going to get Saskia to please read out loud our drug and the expiry date, thank you.
Methoxyflurane, December 2018.
Perfect. I'm going to wrap this around your hand. This, just like that, and you hold it in your hand like this. I need you to breathe in and out through this mouthpiece. And if you need a stronger dose, there's a hole up here that you can put your finger over.
Okay.
Can you give me a couple of... Okay, very good. Now I'm going to get down to setting up, getting the fracture in the splint.
Yeah, of course.
How's your pain feeling now, Alice?
It's the 3.
A 3? Great. Okay. So I'm going to ask that you lift the leg.
Yep.
We just want to make sure that we stay away from the fractured area, which is about here. So we'll try and go under the heel and just below the knee.
Yep.
I'm going to bring the splint in underneath, and then I'll hold on to the weight of leg, and you bring the bandages in through.
Sounds good.
On your count, because you're lifting.
Okay. 1, 2, 3, lift.
Perfect. Nice and slow. Take some deep breaths for that, methoxy.
Lowering. Do you have that weight?
I've got it.
Perfect. Pulling the bandages up.
Deep breaths. You're doing really well.
All set.
And lowering. So get these tied up, leaving the fracture site exposed, so I can reassess those baselines that we had down here. So tie that up.
Yep.
I'm just going to check the distal pulses. They're both even. We've still got a delayed cat refill time. It's still a little cold. Now looks as though that is bleeding through, so I'm going to need to apply a tourniquet. So Alice, your arm, the wound on your arm has not stopped bleeding, which means we're going to need to wrap this around it, basically cutting off any of the blood circulation coming through to try and stop the bleeding. I think we're going to have to do that now because it is important that we try and stop that blood flow.
Okay.
Okay, it is going to hurt. Could you please hold up your arm? I'm just going to keep this elevated as we do it. It is going to hurt quite a bit, and we can't take this off until we get to the ambulance, but you've got your methoxy, and I'll tell you exactly what we're doing as we do it, okay? It's ideal we apply it 10 centimetres above the wound and on a single bone section of the limb. I'm going to tighten this up. Okay, you ready, Alice? I'm about to tighten up this tourniquet. Twist, twist, twist until it's nice and tight. I'm going to check that the distal pulse is lost. Cutting off circulation for sure. Keep going with that methoxy, Alice. And I'll tie that off. You can lower the arm. And I'll get you to go and sort out getting a scoop out for us so we can pick up Alice to the hospital. I'm going to tie that off, write down the time of application. And
It's really sore. When can we take it off?
we can't take it off until we get to the hospital, I'm sorry. Now I'm going to take off your bandages and ensure that we've actually definitely cut off the circulation, that there's no more bleeding coming through. Keep taking that methoxy. When we get into the ambulance, I can give you some more pain relief. We'll try and get you on some ibuprofen and some paracetamol. Have you taken either of those at all today?
No.
No, not in the last 4 hours?
No.
Don't have any known allergies to those?
No.
Perfect, so we'll get onto those as soon as we can get you into the ambulance.